It's 1902. Your child is burning with fever. There's no insurance card in your pocket because there's no such thing. There's no number to call. The nearest hospital is a full day away by train. So you do what every family did. You mix a dose of a popular tonic, bitter, dark, advertised as a cure for female weakness. What's actually in it is almost half alcohol. And you wait for the country doctor who's riding through a snowstorm right now, hoping you can pay him in something other than cash. A sack of potatoes maybe, a cured ham. So here's the real question. With no insurance, barely any cash, and medicine this primitive, how did Americans survive getting sick at all? And here's the part that should genuinely surprise you. They built a working system, and someone destroyed it on purpose. Here's the assumption. No insurance, so healthcare must have been cheap, simple, and manageable for everyone. It was cheap, but not because the system was good. It was cheap because the medicine barely worked. A doctor's visit in 1900 cost very little, but that doctor had almost no real tools. No reliable surgery, no antibiotics, no diagnostic imaging. The real cost of getting sick wasn't the doctor's bill. It was losing weeks of wages while you recovered or didn't. Then medicine actually started working. Anesthesia, sterile surgery, x-rays, real treatment that could genuinely save your life. And the moment medicine became effective, it became catastrophically expensive, climbing from under 8% of a family's medical spending in 1918 to a staggering 40% just 16 years later. The exact moment healthcare started working was the exact moment it became financially terrifying. So how did ordinary families survive this transition? For most of the 19th century, the home was the hospital, and the primary doctor was usually a woman in the family, a mother, a wife, a neighbor. When a real doctor was needed, especially in rural farm communities, cash rarely changed hands. Country doctors kept ledgers recording payments in chickens, bushels of corn, firewood, even labor on the doctor's own land. Roughly 10 to 20% of every doctor's annual billings were simply never collected at all, quietly written off as charity. And to avoid an expensive doctor's visit altogether, Americans turned to something else entirely: patent medicines. The most famous was Lydia E. Pinkham's vegetable compound, marketed as a gentle herbal cure for female weakness and nervous prostration. Here's what was actually in the bottle: roughly 18 to 19% alcohol. That's 40 proof. And during Prohibition, sales of this medicine spiked because it was a completely legal way to drink. But mixing your own remedies couldn't fix a broken leg or deliver a difficult birth. For real medical attention, working-class Americans had quietly built something far more sophisticated than home remedies and far cheaper than anything we have today. By the early 1900s, somewhere between a third and half of all adult American men belonged to a fraternal lodge. Organizations like the Oddfellows, the Freemasons, the Fraternal Order of Eagles. These lodges built something remarkable: a contract with a local doctor to treat every single lodge member and their family for an entire year for a flat fee of $1 to $3. Get sick once or get sick 10 times, the price never changed. On top of medical care, lodges also paid weekly cash benefits, $5 to $10 a week, often 2/3 of a working man's actual wage, to keep families afloat while the breadwinner recovered. In North Adams, Massachusetts in 1914, more than a third of the entire city's population, 8,000 out of 22,000 people, were covered through lodge practice. This wasn't a fringe idea. It was a dominant, functioning healthcare system built entirely by working people, for working people. And for communities excluded from white institutions entirely, lodges meant survival. In 1867, formerly enslaved Americans in Maryland founded the Freedom's Friend Lodge, pooling weekly dues to guarantee sick pay, a doctor, and even a dignified burial, completely independent of the white-controlled medical system that had no place for them. So this worked. It was cheap, it was popular, it covered millions of people. And the American Medical Association tried to destroy it. Organized medicine attacked lodge practice relentlessly, blacklisting doctors who took lodge contracts, lobbying for new licensing rules, pushing minimum price laws specifically designed to make the lodge model illegal to operate. Not because it gave bad care, because it threatened how much individual doctors could charge. By the 1930s, the lodge system that had quietly insured millions of working Americans for pennies a year had been systematically dismantled. So if you weren't lucky enough to be in a lodge and you couldn't afford a doctor at all, where did you actually go? The answer was a place almost everyone was terrified of. Hospitals in the 19th century weren't places people sought out. They were institutions of last resort built directly out of city almshouses, originally designed to warehouse the poor, the homeless, and the mentally ill. New York's Bellevue Hospital, one of the most famous hospitals in America today, began as exactly this kind of institution. The charter promised no one would be turned away. But to actually be admitted to the more respectable charity hospitals, you often had to be vetted by a board of wealthy donors to prove you were one of the worthy poor. Unwed mothers, women with venereal disease, the chronically ill, all routinely excluded, pushed instead into the harsher municipal almshouse wards, where the conditions were treated almost like a moral punishment rather than a medical one. If you had any money at all, you avoided these places entirely. The doctor came to your home instead. Going to a hospital meant admitting you had nothing left. So far, this has all been about ordinary families and charities. But some of the earliest, most extensive medical coverage in America didn't come from lodges or charity at all. It came from your employer, and it came with strings attached. In remote, dangerous industries, mining, railroads, logging, companies had a direct financial reason to keep workers alive. There was no hospital for hundreds of miles, and a dead or injured worker was a problem money alone couldn't fix quickly. So companies built their own medical systems, automatically deducting a small fee from every paycheck to fund a company doctor and a company hospital. The Southern Pacific Railroad started this model in 1868. Thousands of companies followed. The Homestake Mining Company in South Dakota took this furthest. By 1910, they dropped the wage deduction entirely and simply gave every employee and their family completely free medical care. It sounds generous, but historians have a specific name for the strategy: an iron hand in a velvet glove. Free healthcare brought deep employee loyalty, and it was a remarkably effective way to prevent miners from ever organizing a union. So lodges were destroyed, almshouses were feared, and company care came with a leash. None of this was built to survive what was coming next, because medicine was about to get dramatically, catastrophically more expensive. By 1930, the Great Depression had gutted hospital finances. Revenues collapsed by as much as 75%. Beds sat empty. Patients owed money they would never pay. At Baylor University Hospital in Dallas, an administrator named Justin Ford Kimball noticed something specific. A huge share of the hospital's unpaid debt belonged to local school teachers, steady, respectable workers who simply couldn't absorb a sudden hospital bill. So Kimball built something simple. Teachers paid 50 cents a month. In return, they were guaranteed up to 21 days of hospital care if they ever needed it, already paid for, no surprise bill waiting at the end. More than 75% of Dallas teachers signed up almost immediately. The model spread hospital to hospital, city to city, eventually standardized under a new name, Blue Cross. This is the actual origin of modern health insurance, not a grand government plan, not a corporate strategy. One hospital administrator looking at unpaid bills, inventing a fix. But Blue Cross alone didn't create the system you know today. That required one more accident, and it happened because of a war. In 1942, the federal government froze wages nationwide to control wartime inflation. Companies desperately needed workers, but they legally couldn't offer higher pay to compete for them. So they got creative. If you couldn't raise wages, you could offer benefits, and health insurance, untaxed, became the most popular one. In 1943, the IRS ruled that these employer-paid health benefits wouldn't be taxed as income. What started as a wartime workaround became, by 1954, a permanent feature of the federal tax code. Nobody sat down and designed American healthcare to run through employers. It happened because of a wage freeze and a tax ruling, and it simply never got undone. By 1950, More than half of all Americans had private health insurance for the first time in history. But it had taken less than 30 years to go from a working $1 a year lodge system destroyed on purpose to an accidental employer-based system that just happened to stick. This is a history video, not financial or medical advice, so I'm not telling you how to navigate insurance today. But 3 things from this history are worth holding on to. First, the link between your job and your healthcare wasn't a deliberate, careful design. It was a 1942 wartime workaround that quietly became permanent. Understanding that it's an accident of history, not an inevitable law, changes how you think about it. Second, ordinary people, with almost no money and no government help, already built a cheap, functioning collective healthcare system once. It wasn't a fantasy. It worked for millions of people until it was deliberately dismantled. And third, ask an older relative if anyone in your family belonged to a fraternal lodge, a burial society, or a mutual aid group. Many American families are closer to this history than they think. So, what did Americans do before health insurance existed? They built it themselves. $1 a year, a doctor on contract, a neighbor checking in on you when you were sick. It worked. It was cheap. It covered the people the rest of the system refused to. And it was taken apart, not because it failed, but because it threatened someone's income. What replaced it eventually did cover more people, and that's worth being honest about. It's a real form of protection most of us would struggle to live without today. But it wasn't built carefully, on purpose, for your benefit. It was a side effect of a wage freeze and a tax rule, left standing because nobody ever bothered to replace it with something intentional. The version of healthcare you have today isn't the only version Americans have ever built. A better, cheaper one already existed once, and it was destroyed by people who had something to lose if it survived. So, tell me honestly, if a lodge offered you a doctor on call all year for the price of a few coffees, would you have joined? Drop your answer in the comments. Because next time in this series, we're going somewhere just as essential and just as misunderstood. Before police departments existed, who actually kept the peace in American towns, and what happened when they didn't? And I'll see you there.